Hello. Today we have with us Dr. Sanjay Reddy, Director at Center for Diabetes and Endocrine Care, Bangalore. Sir is also a visiting consultant at Fortis, Bangalore. Sir, you had spoken on a topic, Pioglitazone. Has it been written off, for which you debated in the negative? Can you throw some light on the same,
yes,
sir?
Pioglitazone and the class glitazones have been in a lot of for controversies over the years since inception. All started with a cardiovascular safety of glitazone, that was rosiglitazone, and it went on to create a new paradigm in clinical research, and drugs developed after rosiglitazone were all advised or regarded to undergo CVOT or cardiovascular safety trials because the drug rosiglitazone showed that it increased cardiovascular risk. The other class of drug, which is in the same class called pioglitazone, has been around for some time, and it's a drug which is effective in the treatment of diabetes, especially in patients who do not have heart failure. It has the duration and durability of the drug is very good. It has good glycemic control, cheap and effective, and if used judiciously, it can be one of the wonderful drugs in the armamentarium of management of diabetes. We have a lot of data coming recently indicating its cardiovascular benefits. In way back 6 to 10 years back, proactive trials showed us this. Now, there is new studies called the IRIS study, which pioglitazone was given to patients with cerebrovascular disease, one of the first drugs investigated for benefits in cerebrovascular disease in non-diabetic patients, and it showed decreased cerebrovascular accidents or reoccurrence of cerebrovascular accidents reduced when people took pioglitazone. Though there are concerns of when you use pioglitazones in regard to weight gain, heart failure, fracture risk, and the most scary thing which came on, and pioglitazone went on into the red for some time and was also withdrawn by DCGI and reintroduced back because of the bladder cancer risks. Many studies have come in to show that if you take more than 24,000 grams of pioglitazone, it's a cumulative risk over 10 years, the chances of bladder cancer may increase. But there are many other studies which have come and shown us, and many retrospective studies and meta-analysis which proved otherwise. But in an Indian population where cost is one of the mainstay of treatment, or it is one of the hindrance to treatment, to pursue drugs which are new and expensive, though preferable, but glitazones cannot be written off. They are effective because they address various pathophysiological mechanisms which are very helpful in the management of diabetes. And recent data showing that pioglitazone is also effective in NFALD has given it much encouragement. And if we use pioglitazone in a low dose between 7.5 and 15 milligrams, a lot of Indian studies have shown they have similar glycemic benefits and similar cardiovascular protection, and used in patients over a period of time. And as we move on in diabetes to individualized care, if you select your patient judiciously, pioglitazone is also an option in the armamentarium of treatment of diabetes.
Thank you, sir. Very well summarized. Sir, you mentioned about pioglitazone receiving a little negative name because of the cardiovascular safety fronts of the class effect of glitazones. And you also mentioned about bladder cancer. You very wonderfully also mentioned about different studies which have come to question the same. So any newer perspectives on cardiovascular outcomes?
Yes, there was a recent article written by Dr. Stevenson and Dr. Ralph DeFranzo. Dr. Stevenson was one of the persons who pointed out cardiovascular cardiovascular safety issues with rosiglitazone. The article written in 2019, which has come out recently, showing that low cost, have we forgotten something called pioglitazone as a low cost alternative to cardiovascular disease prevention. It's a very good editorial. I request all of you to read it. It is Pioglitazone revisited, looking at all the benefits and the risks, and the authors comment that using pioglitazone also decreased cardiovascular risk over the years.
Very well put, sir. So, considering the fact that we Indians have a phenotype wherein we have a lot of visceral obesity, less of lean muscle mass, we are more prone to insulin resistance, and hence scenarios like PCOS and NAFLD. So, what is your take on pioglitazone in such scenarios? Shouldn't it be taken up higher in the level of guidelines for
it is
Indian
there
patients?
already in the guidelines, but as I mentioned, the benefits of pioglitazone are very well known, and also the adverse effects which pioglitazone, like any other drug which is available in the market, benefits and risks are there. It is for the individual doctor treating the patient to individualize according to his needs. We all know that insulin resistance is very high among patients, Indian patients who have less muscle mass compared to the same nearby with the Caucasian population. It is a good drug in our population to be used in settings where it is there are no contraindications for the use of pioglitazone.
Thank you very much, sir. Thank you very much for your time.